We're talking about surgical weight loss and body contouring. We've seen a lot of patients come to our practice with having lost a significant amount of weight, whether that's with diet and exercise or with surgery, whether it's the Roux-en-Y bypass, the gastric sleeve, the vertical banded gastroplasty, or even medical weight loss with Ozempic and a lot of other medications like phentermine, and patients are losing a lot of weight. So they are taking charge of their health, which is amazing because it obviously makes them healthier. But the problem is that a lot of patients are still very depressed after losing a lot of weight. And the reason for that is they're in the gym, they're with their personal trainer, they're exercising, and they can't get rid of loose skin. And conceptually, it's very frustrating for a particular patient because that idea is kind of like having a dress that's too big or a suit that's too large and throwing it in the wash and hoping that the suit or the dress is going to magically tighten to your new small body. That's just not going to happen. And so the only option for that is to remove the excess skin. So in some ways, as funny as it sounds, plastic surgeons are nothing more than tailors for the human body, okay? Whether it is for the face, the aged face with all the sagging area of the neck, or the sagging area in the arm. There's a lot of laxity in the abdomen. There's a lot of laxity or skin looseness in the thighs and the buttock. And literally, post-volume deflation causes a significant amount of sagging, and it just creates an unnatural appearance to the body, and it can be often actually very frustrating and oftentimes even depressing. And so surgical weight loss, although it can make you healthy, can also create a situation where sometimes patients obviously don't like what they see in the mirror. And really the treatment for this is surgery. And it's often, it's interesting when I talk to patients, during their consultation and I do their surgery, sometimes 6 weeks or 3 months later, usually what we get is, I don't know why we waited so long. And I think a lot of that is because they're hoping, and they're just hoping that magically, just with being in the gym, that they're going to be able to tighten loose skin. So that's obviously not the case. From my standpoint, I wish more patients would actually consider going to see a board-certified plastic surgeon sooner than later, because it's only going to help treat the inevitable, which is the fact that loose skin cannot be tightened in any other way. Significant amounts of loose skin cannot be tightened any other way except the surgical excision. So hopefully this was helpful. If you guys have any questions, please reach out to our practice and one of our patient care coordinators who are extremely knowledgeable with this, because we do a lot of these kind of procedures, can help guide that process up front before coming in to see yours truly for a consultation. So hopefully this was helpful. Thanks for tuning in, and until next time.